However, negative mental health can occur either from when you are not happy, when you are sad, when you are happy. Those are positive, those are negative mental health states.
Okay.
You see, when you have a mental health state that is negative, of course, after a while, you get well. Where we are interested in now is the mental health illnesses. That is
Okay.
why I'm being paid to work on.
Okay. So let me get this now.
Yes.
So are you saying a negative mental health can grow into a mental health condition or mental health
If
illness
not checked on
properly?
time.
Now I get the thing. Like now it's not very understandable.
Yes. If not checked on time. For example, somebody can just, maybe his house got burnt. You know, I'm not happy about it. I could feel sad and worried, like, where am I going to get the money from? What happened and this and that. But it's expected that after some time of grieving or worrying, life goes on. But when you are not able to go back to your normal state of mind, it now starts affecting you. Don't go to work again. Why are you not going to work, Oga? My car, my house, we're born. You sit down. You're not going to the office. You are doing nothing about it. Anybody that comes, you don't have anything positive again to say. You then start looking for negative coping mechanism, like drinking, to forget about the pains from the house that may have burned. Then you can now say, oh, this person needs to see somebody. This person needs to be intervened upon. You get what I'm trying to explain?
I get what you're saying.
So you could have somebody not happy about certain things, but really nobody's happy in the world. Even in Texas some days ago, they shot people in a primary school. They shoot people in the hospital, everywhere. People are not happy. A lot of events are going on.
Okay.
Yes, a lot of events are going on. Nobody's happy about it. But if everybody now decides to stay, no, we are not happy, we don't move, then you now know that it's a major problem.
Yeah. Okay. So what are the early signs, the pointers that can tell that, okay, this person's mental health condition is not tilting to becoming a mental illness?
Okay. Yes. The early signs, it all depends on okay, let me just there could be a lot of early signs. For example, one could observe somebody who was naturally a happy person, boisterous. You now notice, okay, he's always not happy, crying. You know, he's having what we call weeping spells. All right, and then you notice he's no longer eating as he used to eat in the past. His energy level has come down. He's no longer as strong as he used to be. His sleep is poor. He tells you, when I sleep, I don't sleep so much again. I wake up, I'm not able to go back to sleep, or I spend so much time trying to catch sleep, doesn't come. Later during the night, the sleep down comes. You notice that he's losing weight on a regular basis. You observe he or she is no longer concentrating as he or she used to concentrate in the past. You know, seems to be getting more angry more frequently. Little things get him angry. He seems no longer to be interested in things he was always interested in doing. For example, I love singing, I love going to church. You now notice that this young man, this young lady is no longer going to church, or no longer interested in going for choir practice as the person used to go. So all those pointers are things that will make you think that something is wrong, and he or she needs to see a specialist, you know, to look into the matter, because sometimes those early signs could just be, like I said, as a result of probably an event that just happened. Okay, expected after some time it goes up.
The person might
Okay,
bounce back.
When you watch and you see that
this
thing seems to be prolonging, then the person needs to see a specialist.
Okay, so now let's talk about some common mental health disorders.
Okay, common mental health disorders which we have. Well, there are quite a number of them. I'll just talk
Let's talk
about the
about,
common
yeah,
ones.
the most common.
Yeah. We have what people call dustbin craze, schizophrenia. We have affective problems. Affective problems could either be you could have a depression, you could have mania, you could also have a combination of both of them, which we call a bipolar. We have anxiety problems. We have post-traumatic stress disorders. Okay, we have childhood psychiatric illnesses, you know, and quite a number of them, a huge gamut of eating disorders, so many of them which can be listed. And for us to make a diagnosis for each and every one of them, there have to be certain criteria which must be met. So you don't just wake up and say, this person has this or this person has that. There are certain criteria which the patient must meet before you can make a diagnosis and also render help to that individual. For example, now you say, okay, doctor, this man, they carry him, he say in the hear voices or this, and he's not behaving well at home. So by the time he comes to the hospital, and then he's seen, okay, probably he sees the doctors at the general practice clinic, they refer him out to the mental health unit. You start asking questions as a follow-up to that initial symptom which may have been identified by the relatives. So your ability to pick those various symptoms, both spoken and unspoken, will make you make a diagnosis. And then you can now say, okay, this is a condition, which is a mental health condition that needs to be treated.
Okay, so let's dwell on some of these mental health disorders you just mentioned to get a little bit in-depth knowledge of them. You mentioned schizophrenia. What is schizophrenia?
Okay, schizophrenia is a mental health condition in which the individual has problem being able to process his thoughts. You know, it almost seems like he has what we call disorganized thinking. Everything seems so confusing to him or her, right? And it occurs both male and female, and most times it happens between the ages of 11 to 12 to about roughly 42 or 45. That's the commonest range. It's not as if you don't see it in the elderly, but that is the range you expect to see it. Okay, and a lot of symptoms are associated with that schizophrenia. For example, we have what we call delusions, okay, holding on to beliefs that are not true or real despite evidence to the contrary. We may have what we call hallucinations.
So are these people, were they hypnotized, or is just as
No, they were not hypnotized.
it's an event that leads to this?
Some of them, it could happen that use of hard drugs trigger them.
Okay.
It could also be genetic because there's sometimes some of the mental health illnesses have family histories.
Wow.
Okay.
Really?
Yes, and then the environmental factors will now trigger it, and it will now express itself. So you hear those, they complain about the voices, they complain about their personal hygiene, they complain about the fact that they seem to be having what you call almost like odd behavior. You pick things on the floor and you are hoarding them at home. You go to the room, you see the room scattered with all sorts of papers, iron, a lot of debt that they keep within the room. So when you see such cases, you tell yourself, okay, let me look at the criteria and then see if this person is going to make the diagnosis for schizophrenia. Then we talk about depression. Depression, which is also very common and a very salient psychological disorder, is there because people may not know when they slip into depression. It's a bit masked. Yes, it's a bit masked. People don't talk about depression because you see an average adult telling you that depression is because you are not strong mentally. You are not strong, that's why you will be depressed. But that is not how it is. People are depressed, sometimes hide their symptoms, and nobody is really aware of what is going on.
So, but you made a very strong statement. You said that people can slip into depression without them knowing. How will one be depressed and the person won't know?
Yes, you slip into depression not knowing because you don't know the criteria for making depression. That is what I mean by slipping into depression without their knowing,
So
their
tell
knowledge.
us.
There are some criteria in which you use to make depression. In psychiatric practice, we have mild, moderate, and severe. Each aspect of it have their own various criteria. I'm not going to start dwelling into what makes each, but generally, the three main things you look out for in a depressed individual is number one, persistent unhappiness, low energy, and reduced interest in pleasurable activities. Those are just the common three key features. And then with a myriad of other supportive symptoms.
Okay.